32-year-old Chitralekha resolutely heads to this community health center in Sadhaura in Haryana state. Her 3-year-old daughter Akshita has been suffering from sore throat, cough and vomiting for over a week. She is attended by a doctor. It has saved her mother a long bus journey to neighboring Ambala and a hefty consultation fee.
जैसे ही आती हूँ पर्ची बन जाती है और साथ के साथ दवाई मिल जाती है। और अगर कोई थोड़ी बहुत बीमारी होती है वो हम सब सेंटर चले जाते हैं, वहाँ एएनएम बहन जी होती है, उनसे दवाई ले लेते हैं। और कई बार तो घर पे आशा वर्कर आती है, जैसे बच्चे को वोमिटिंग हो रही है जैसे तो मतलब उल्टी वगैरह में वो हमें बता देती है कि आप इनको ORS घोल पिला दो, तो वो पिला देते हैं, तब भी आराम आ जाता है।
Fair and equal access to healthcare services had once been unthinkable for socially disadvantaged and marginalized women in India. The country's health indicators put in perspective the story of its maternal and child health conditions. India accounted for 19% of all global maternal deaths in 2010. In India, every year, over 300,000 babies die at birth and around 1.45 million children die before their 5th birthday. To address this problem, India co-convened the Global Child Survival Call to Action, a Promise to Keep summit. The summit posed a fresh challenge to the world to reduce child mortality to below 20 child deaths or fewer per 1,000 live births in every country before 2035. The then Union Minister for Health and Family Welfare, Shri Ghulam Nabi Azad, reiterated India's commitment to bending the curve on child mortality and morbidity. The Government of India kept its promise, pledging its highest ownership and prioritization to this call. In 2013, the Government of India held its own national summit on the call to action for child survival and launched a new, holistic, reproductive, maternal, newborn, child and adolescent health strategy known as the RMNCH+A strategy.
RMNCH+A, which does a number of things for the first time. One is that we said that there are strong interlinkages between sets of interventions that we have been talking about and pursuing really very independently in vertical silos. For instance, we have been talking of family planning as more as a population stabilization strategy, but we did not really look at it as a critical health intervention to improve outcomes for mothers and children. So now we repositioned family planning as a very strong way of making sure that less mothers die and less children die in India.
USAID as well as other development partners have worked closely under the leadership of the Government of India to support the call to action and the RMNCH+A strategy nationally. MCHIP has provided technical assistance to the Government of India at the national level and in 6 states as USAID's lead RMNCH+A partner.
The biggest strength of MCHIP is to work very closely with Government of India and state government. We worked very closely on a day-to-day basis. MCHIP provided several pieces of support under this RMNCH+A rollout. We provided support and we helped the Government of India in the selection of high priority districts.
Though the RMNCH+A strategy was launched in 2013, results are already visible. For 30-year-old Pinky, with 2 young children and expecting her 3rd, home visits by accredited social health activists, popularly called Asha Behenji, ensured that Pinky was given the right guidance.
मेरे पास आशा बहन जी वर्कर आती हैं, वो मेरे को सलाह देती हैं भी खाने प्रेगनेंसी में क्या खाना चाहिए, अंकुरित दालें। आशा वर्कर मेरे बहन जी मेरे पास आई थी पहले भी टेस्ट कराना है, हमने टेस्ट किया, मेरे 3रे महीने में चेकअप हुआ, एक 5वें में और एक 7वें मंथ में चेकअप हुआ।
अभी एक चेकअप रहेगा 9वें मंथ में होगा।
Frontline health workers, including ASHAs, auxiliary nurse midwives, nurses and doctors, are providing integrated services to women and children throughout India. Through effective community mobilization, ASHAs and auxiliary nurse midwives make it possible to link health services provided in the home with those provided in health facilities. They in turn gain from intensive support supervision, on-site training and mentoring to enhance and optimize their knowledge and skills.
एक रैपिड टीम आती है यहाँ पर और हमें तरह तरह के प्रशिक्षण नवजात शिशु के बारे में और मदर के बारे में बताकर जाती है। उससे पहले जो हमारा स्किल लेवल था वो बहुत ही पुअर था और हम जिससे कि मदर को भी इन्फेक्शन होने के चांसेस होते थे और बेबी को भी। ये हमें प्रैक्टिकली डमी पर बताकर जाते हैं। उसके बाद हमारा फॉलोअप भी लेते हैं। उसके बाद हम उसको डेली रूटीन में उसी तरह से मेंटेन कर रहे हैं। इसके बाद जो हमारा इन्फेंट मोर्टेलिटी रेट है और मदर मोर्टेलिटी रेट है वो बहुत ही कम हो गया है।
The quality of health services is crucial to the success of the RMNCH+A strategy in high priority districts. To significantly improve the survival of mothers and children, they must have access to good quality health services.
There are three critical and important components which we are doing with MCHIP. First is relating to the quality of cold chain points. Second is relating to the essential newborn care facility readiness assessment. And finally, we are doing the intrapartum and immediate postpartum modules which are helping us to improve the quality of services.
A strength of the RMNCH+A strategy is that it communicates using easy-to-understand technical documents, state-specific scorecards, and dashboards. The 5x5 matrix has become an important training and management tool. The matrix lists proven health interventions at 5 important points in the lives of women and children: pre-pregnancy, pregnancy, labor and delivery, early childhood to age 5, and adolescence. The gap analyses carried out in each state as part of the RMNCH+A rollout revealed ways in which the quality of care for all women and infants could be improved. Like at this maternity home in Selampur in Northeast District of Delhi, young mothers line up to get their newborns vaccinated. An auxiliary nurse midwife instructs them on breastfeeding while another counsels antenatal care patients. The government's efforts at the highest policy level and the critical role of development partners like USAID have resulted in a robust model for expanding the reach, quality and outcomes of government health services for women and children. One that is inclusive, participatory and continuously evolving.
I think the most impressive shift that I've had the opportunity to see is really kind of a very close alignment and harmonization of the kinds of technical expertise that's being brought in, other international models, and also taking the best of what India has to offer, which is quite substantial in the area of innovation, whether it's medical technology or really a much more robust system of monitoring and accountability in terms of public health sector delivery.
The Government of India is committed to protecting the lives and health of women, children and adolescents through the RMNCH+A strategy through a continuum of services, constant innovation and routine monitoring. USAID is committed to working with and under the leadership of the government to ensure that India achieves the goal of ending preventable child and maternal deaths. The eyes of the world are now on India.